Mark Urban with Ukraine's Foreign Affairs Minister. Now, thousands of women with epilepsy have given birth to babies with disabilities after they took an anti-epilepsy drug during pregnancy because they weren't warned about the dangers. The drug, called valproate or sodium valproate, has caused autism, learning difficulties and physical disabilities in up to 20,000 babies in Britain. Former Health Secretary Jeremy Hunt once compared the effects on unborn babies to the scandal of the morning sickness drug thalidomide, which caused disabilities in thousands of babies after it was licensed in the UK back in the 50s. Tomorrow, extra new restrictions will come in which will tighten further who valproate is prescribed to. Kate is here. Tell our audience about it.
Yes, so tens of thousands of people here in the UK take valproate to manage epilepsy, bipolar disorder and a small number of cases of migraines. For some, it will be the only drug which can adequately control their seizures. But ever since valproate first came onto the market back in the 1970s, it was known that it could affect fetal development in animals. And that raised the suggestion that there could be a risk to women who took the drug while they were pregnant.
So what are the risks?
Well, we've learned a lot over the preceding decades, but today studies suggest around 11% of the children born to women who take valproate during pregnancy have major congenital disorders. Now, that is much higher than the general population, where it's around 2 to 3%. And 30 to 40% of these children born to women who take this drug experience delays in early development, things like talking and walking, as well as poor language skills, memory problems, and lower intellectual abilities. As you mentioned, there is also an increased risk of autism spectrum disorder and ADHD.
And so, did the people taking the drug know about the risks?
Yeah, this is really the crux of the matter. As early as 1974, the Committee of Safety of Medicines recommended that for women of childbearing age, valproate should only be used in severe cases or for women who couldn't use any other treatment. And that information was passed to doctors, but those prescribed it have been clear that those risks weren't always shared with them, or that their concerns were dismissed by medical staff who were focused on treating the mother's condition. Now, an independent review in 2020 recommended that a scheme should be set up to meet the cost of providing additional care for those families who experience what they described as avoidable harm. That is a recommendation that was rejected by the government.
And what is actually happening tomorrow then?
Yes, so in recent years, regulations have been tightening. In 2018, for example, a pregnancy prevention programme was introduced for those who are prescribed it. Since then, the number of women taking this drug has reduced, but there have still been examples when a prescription has started the same month that a pregnancy has been recorded. So the restrictions introduced tomorrow will mean that no patient, male or female, under 55 will be given the drug unless two specialists independently judge that there are no alternatives.
OK, thank you very much, Kate. Thank you. We're going to speak now to Karen Buck, a mum of 4 grown-up children, all of whom have disabilities. Karen was taking valproate to treat her epilepsy through her 4 pregnancies. Karen, thank you very much for being with us. Were you warned about the risks?
No, not at all.
Not in any of those pregnancies?
Not in any of those pregnancies. It wasn't until I had my 3rd child and I was 6 months pregnant that I was told that I had a spina bifida daughter with hypercephalus. And I was basically told to go in a room because I was crying and wait for a consultant to come and speak to me. They left me in there for a whole hour, crying my eyes out, not knowing what this condition was. And then when I came out of that room, I saw a nurse going past and I then flagged her down and basically turned around and said, is there a doctor around? I need to speak to someone. When she said, who are you? And I said, I was a woman in that room with all them consultants telling me and looking on the screen and looking at me and saying that I had a child inside me, which was basically a spina bifida child with hypercephalus.
And before Bridget, you had Josephine and...
John.
John, that's right.
Yeah.
And they had disabilities to a greater or lesser extent. When you were pregnant with Bridget, was no one joining the dots here about the epilepsy drugs?
No, none at all. And I didn't even think that there was anything wrong with Josephine or John.
Right.
To my knowledge, that they were perfectly normal children. It didn't.
I've got this lovely picture here.
It didn't come apparent until my daughter, when I had her, that how so severe she was,
Right.
that I knew, and I linked it to the medication.
You did?
I did.
You were the first person to
I
do that?
was, yeah.
Okay.
I had people telling me that, like, it's just one of those things. It happens.
Right.
You know, it wasn't the medication. It's just unfortunate. That's what I kept getting. It's just unfortunate.
And then you became pregnant with Christine.
I did.
And how is she?
She's okay to look at, but because her mental status and that she isolates herself away from everybody. She don't, you know, really interact with people.
And at that point, did anyone say, hang on a minute, you now have 4 children with disabilities, physical disabilities, sometimes learning disabilities.
Yeah.
Let's look at why this might be, i.e. what drugs you were taking during pregnancy.
No. At that point, I took it in my own hands then, and I went and had my tubes tied.
Right. I was not expecting you to say that, Karen, I've got to be honest. But I completely understand why you did that. Why, what is it like looking after Josephine, John, Bridget and Christine?
Well, obviously, Josephine, she's got a family of her own now.
Right.
For her, she's trying to live a life. But obviously, she's got spinal problems. But she's trying to live a life. And she's got a little bubby herself. I do help her time to time. But with John, he's got a twisted esophagus and a hiatus hernia. He suffers with dyslexic. And he has breathing problems. But nobody wants to help. Nobody wants to acknowledge these problems. Obviously, Bridget, she's the world's worst. Nobody wants to take accountability for it. Nobody wants to help.
And when you're looking after Bridget, that is, presumably, that's 24/7.
It is.
7 days a week.
Yeah. She's bedbound.
Is she?
Yeah, she's bedbound. I don't get no help from no one. I got cancer, and it wasn't until I was having chemo, 4 years in my remission, that I finally got carers to help. So I have a carer now come in from 10 till 4:30. That's the only help I get.
Who do you blame for this? Who is responsible?
There is a few people I blame. I don't think I'm allowed to name names. If I could, then I would say it. But obviously, you've got the drug there. You've got the government, and you've got the NHS, and you've got the people that supply the drugs. I do believe that they are all accountability for this, because they knew. They did know. And I've left a single mother now, you know, trying to look after this sick little girl, you know, who's now a young woman who's bedridden with brain damage. I have to catheterise her. I have to clear her bowels out. I have to feed her. She's got multiple different illnesses. She's even got Lennox-Gastaut syndrome, where she's having seizures 24/7. I have to issue her emergency med. I have to issue her oxygen. I have to suction her out. There's so much stuff I have to do. And I even have my own condition, you see, and I don't get no help for that.
I don't know if you heard Kate say there was a review into this drug, and one of the recommendations was that there should be some kind of scheme set up to pay redress, to pay compensation effectively. Not that you can compensate for what you and your children have gone through, but perhaps it would help you pay for carers to come into your home. But the government rejected that at the time.
They did.
How did you feel about that?
How would any mother feel? I'm mourning my daughter now, and when she does die, I ain't even got the money to actually bury my child. You know? I have to save up bit by bit. I can't even get insurance out on my daughter. Like we, as people, we have life insurance. I can't even get insurance on my daughter because of her disability. You know? How would that make any mother feel? You know? I can't even go out there and get a job because I have to look after my sick little girl. How would that make any mother feel? I can't even have a life.
Yeah.
You know? How would that make any mother feel? When she was 19, she was in hospital fighting for her life. You know? This has happened several times. I've got oxygen in my house, which I have to give to my daughter. No mother should have to, face that. I shouldn't have to face my little girl in that bed every day, fighting for her life. This is what these people have done to me because they didn't tell me about this drug. No mother should have to put up with that.
I am so sorry. I am so, so sorry, Karen.
No mother should have to go through what mothers and fathers out there.
Yeah.
And I told the MHRA back in the year 2015, this is not only affecting women. Don't just pinpoint women out there. Young men have seizures and take this drug. It affects their sperm count.
Yeah. Which is why tomorrow this new guidance is regarding men and women. Yeah.
It's took them from now until back then to recognise that this affects men as well. I kept persisting and telling them. I went all the way over to Switzerland and I told Switzerland and they jumped on it. And it wasn't until Switzerland told them that this drug affects men.
Okay. Karen, thank you very much for being with us.
It's heartbreaking.
I know, it is. And I'm so glad that you've spoken to the nation tonight and told them exactly what the reality is. Thank you very, very much, Karen.
You're welcome.
Thank you. That's all from us tonight. Kirsty's here tomorrow. Have a good rest.